Hi, this is Dr. Ahmed Soliman Higazi. I'm an interventional cardiology consultant at the Heart Institute of Caribbean. I'm so happy today to show you the first time in Jamaica to use Rotablator, which is a device to rotate inside of the vessels and try to ablate any excess calcium there. So this old lady, like senior lady, we have it here today after having like unstable angina symptoms back and forth. She had a stent done last year in the diagonal branch, as we can see, it's put here, but still having very tight lesion in the mid-LAD that we tried twice to get through with a balloon or other equipment, but it didn't go through because of heavy calcification. So we decided to go for the procedure of rotablation. That is something like a drill to go through that calcium here, because this is calcification that's blocking the vessel. As you can see, it's almost 99% blockage. And with the regular and traditional equipment, we'll never be able to get through to the distal vessel. So today we started our procedure by putting a wire, and then we tried to pass a microcatheter, which is a very thin tube, to pass to the end of the vessel so we can change the wires as we may need after that. But unfortunately, because of the severe calcification, even the microcatheter didn't get through. So what we did is we put the microcatheter at the beginning of the lesion, and then we pushed that the wire of the rotablator wire, which is a very thin wire and it's a very delicate one, but thank God it went through and it went to the distal end of the vessel. This is what's called the rotablator bear. That is a very big bulky head that it rotates almost like 160 to 180,000 rounds per minute, with a head is full of diamond, which make it like a sand, something like sanding, so it can ablate the vessel. So after multiple runs, actually the lesion was very tough. We tried many times to go through. You can see here that we are trying to navigate and pushing through the lesion by picking maneuver. As you can see, started to ablate the proximal end of the lesion, and then many trials were done. It was very tough actually, and even the rotablator burr didn't go through to the whole length of the vessel. But actually, as you can see, the lesion started here to here. So we can say that we at least ablated almost 50% of the lesion. And then we were asking ourselves why it doesn't want to go through the full length of the lesion. So after many ablation episodes, we decided to take it out, and then we passed a new wire, and this is the balloon that it goes very smooth now, because we ablated what's called a calcific nodule, which is like a very small rock at the beginning of the lesion that it prevented all our equipment from going through. This is the ballooning, and then we took a picture, and as you can see that we had a very beautiful, this is the calcified nodule, the place of the calcified nodule, and when it's ablated, we now managed to go through the artery and even like after the lesion. So, and this is the stent. We are adjusting the stent, and this is balloon and so on, and then it showed complete resolution of the lesion. This is what's called post dilatation, and just to make sure that the stent in the vessel is fully dilated and open. And this is from another view here. This is the 99%, as you can see here. This is what it was before, and that is now. So thank God, definitely rotablation is not a new technology. It's a very old technology, actually maybe more than 20 years, but definitely providing this in developing countries, it's sometimes a little bit challenging because of the cost and the materials and the support. So from my background, because I'm a CTO operator as well, so I have the exposure to those kind of procedures, but the challenge was to provide it here in Jamaica. Here at HIC, definitely we adopt all the new technologies and all the new procedures, or I will not say new, but at least new for the Jamaican market. So we can provide all Jamaican patients with state-of-art procedures. Also, I would like to thank Dr. Madhu, who also worked very hard with us to provide us with all the equipment needed, and that's the end result. I hope that this is just the start, and I hope that from now on we will try to provide the Jamaican patients with the best procedures and the best way of treatment that they deserve. Okay, thank you, and see you later.